Peace of Mind, Exploring Universal Basic Income's Potential to Improve Mental Health, a project funded by the Scottish University's Insight Institute. Our project relies on you, our participants, and we want to thank you very much for taking part. This short video introduces the project and explains how you'll take part. I'm Matthew Smith, Professor of Health History at the University of Strathclyde Centre for the Social History of Health and Healthcare.
I'm Cleo Goodman, co-founder of Basic Income Conversation.
I'm Michael Pugh, and I'm the director and co-founder of the Basic Income Conversation.
My name's David Carless. I'm a researcher, writer and musician, and I'll be contributing to the story writing workshops that are taking place in January.
I'm Katrina Douglas, and I'll be facilitating the creative workshops with David.
Hello, I'm Professor Mike Danson, an economist and chair of Basic Income Network Scotland, the national body to promote basic income in Scotland.
My name's Jamie Cook, and I'm the head of RSA Scotland, and I've been active in the discussion around basic income for quite some time now.
Our project explores the relationship between universal basic income and mental health.
As we've seen from the impact of the coronavirus pandemic, the insecurity that so many people face and the impact that can have on their mental health is huge and significant, and therefore we need new policies to be able to respond to that.
I think this project is important because our mental health is important. Currently our systems for mental health care and for income support are both based around solving crises, but we shouldn't be waiting until people are in a crisis to offer them help.
This project is personal to me. My mum has bipolar, and I grew up seeing the impact that low income has on mental health. Income insecurity makes existing mental illness much worse. It's made me angry to see a loved one go through the means-tested benefit system with the lack of dignity and compassion that it has, and often makes things worse, not better, for people with mental health conditions. And I believe basic income can change that.
At various times when I was growing up, my family faced poverty with all the stresses and strains for family life that creates. During my married life, we've had chronic illness, disability, and that's generated its own mental health issues. A basic income would have given dignity, security and stability during those years, and without the stigmatisation and all the other issues generated by filling out forms for the DWP and meeting their conditions.
I've had my own issues with my mental health. I've been friends with people, my family members have had issues, and they're never improved by having financial struggles. A basic income is an opportunity to address that at the root and make sure that people have financial security as a right, rather than having to ask for handouts when they're really in need.
For me, basic income is an opportunity to try and address some of that insecurity and isolation and give us a better chance to respond to the challenges and opportunities we face.
A basic income meets basic needs. It's paid to each and every individual on a regular basis, as of right, without means testing, without conditionality. It can't be withdrawn. It would make a big difference and will do to people with mental health issues, with financial problems.
One of our goals of our project is to ensure that people working in mental health and people advocating for basic income work more closely together. We are also hoping to inform the upcoming Scottish elections in 2021. But to do so, we really need to hear your story about mental health and financial insecurity. That's why we've asked Katrina and David to conduct storytelling workshops with you all. After the storytelling workshops, you'll get the opportunity to share your experiences at our workshops on the 15th and 16th of February. The first workshop will focus on your experiences of money and mental health, and the second workshop will explore how basic income could make a difference.
Thanks again for your help with this project. Do get in touch with us if you have any questions.